All right. Now we recognize Mr. Flores from Texas, who's also new to this committee, third term in Congress, and we welcome him to this subcommittee.
Thank you, Mr. Chairman. I also want to thank the panel, particularly for your positive comments regarding the benefits of having children vaccinated for measles. I have an extended family member who has not done that for her children yet, and it just baffles me why she can't do that. And so I hope she's hearing this today and that she heard your comments and that she will do so. I want to talk about the weakness in the strain selection process and talk about the opportunities to mitigate that weakness. And I want to focus my questions to you, Dr. Robinson, because BARDA is a tool, I think, that we have to do this. And so my first question is this: is BARDA funding any projects or initiatives to develop two things? One, better technologies, testing technologies, or two, better approaches for making the vaccine candidates?
So the answer is yes on both. Let me just, as my testimony, I identified that we're supporting the development of evolutionary biology methods that would actually help the existing methods inform what strains are out there. There's so many ways a virus can mutate. Right. We know that actually you can do the experiments to show which ones would predominate, and that may actually inform of which ones we may see in the next season. And certainly the underpinning of that, the NIH has funded over the years, and so we're moving it forward primarily for our pandemic purposes, but certainly could be used in seasonal. So that's one way in towards the selection and then informing new vaccine designs.
Okay.
Secondly, with the technologies we have supported with our colleagues here from NIH, CDC, and FDA, new technologies to make these vaccines, whether it be cell-based or recombinant. And working with the NIH, we're looking at universal flu vaccine candidates, a number of which Dr. Fauci enumerated, of going forward. It's not because those technologies haven't been tried before, but as he explained, there is a limitation in how the body actually sees these viral proteins. And so there's some new ways now that we can do that we couldn't do before. In
terms of looking at BARDA's priorities, where would you say that this getting these better technologies for this strain selection process is in your sort of list of all the things you have to do on your wish list? Yeah. Is it the top third or the middle or the bottom? Or?
No, it's at the top.
Okay, yeah. Great. It sounds like we should keep it there, and from what I'm hearing today. The third question is, how can we expedite the development and deployment of better technologies, say the use of genetic sequencing to detect virus change, which you've talked about, to ensure that the U.S. has a vaccine that can be matched to a drifted H3N2 strain?
Certainly one of the ways that we actually have employed was biosynthetic technology, working with the Craig Venter Institute and then one of the manufacturers. We did that in 2013 with H7N9 to actually come up where we didn't need the traditional way of having the virus actually sent from one laboratory to another. We actually had the nucleotide sequences available, then using that and actually made the virus seed strains and went forward with H7N9. Regardless if it's an egg-based or cell-based or recombinant, we can do that. Okay. And we're moving forward with those efforts also. I just want to say one other thing that Dr. Mithun had talked about, and that is high production yield seed strains. Why is that important? It means that the virus doesn't have to be passaged in eggs or cells many, many times, because very early on, we can actually have high production seed strains. And that's why the manufacturers keep passaging the virus to get high production. If we have that immediately, then the virus that actually is in the vaccine is going to be very similar to the circulating virus, much more so.
Okay. And then last question has to do, I've always been fascinated with the initiatives to try to develop the universal flu vaccine, and I appreciate what Dr. Fauci talked about today and educating the committee and subcommittee on how to do that. What role does BARDA play in the development, deployment, and stockpiling of a universal flu vaccine?
So certainly hand in hand with the NIH, we're moving forward with the development, not only for seasonal, but as I pointed out, for pandemic purposes. It may serve as a primer for a future pandemic vaccine. So again, you may only need one dose of the pandemic vaccine as opposed to two, which you normally would need. And so we could stockpile that vaccine or actually have it as part of our commercial products that are out there every year.
Okay. Thank you for your responses. As you know, it's a this is important to me because you have a facility in my district that I think is doing some great work. Mr. Chairman, I yield back.
Thank you. And now